I'm sure you often ask the question, how does homeopathy actually work? Today, I'm going to be talking to Dr. Nitin Deshmukh, and we'll be discussing just that question. Hello, thank you so much for joining us today. And I'm so pleased to be able to welcome back Dr. Nitin Deshmukh. How are you, Nitin?
Yeah, I'm doing good, Mary. Thank you. Thank you for calling me again.
Well, I'm really excited about this because we have thought about which aspects of homeopathy to talk about. And today we're going to go right back to basics and talk about how does homeopathy actually work. So
Fine.
when somebody would ask you about homeopathy or how homeopathy works, what would be the first thing that you would want to explain to them?
See, this is the most debatable question since many centuries, no? So I'll tell them that first you experience and then you tell because it works every time you take it.
And so let's just go into the basics of homeopathy, because why is it different than mainstream medicine?
Right. See, the development of homeopathy has been made by a physician, Samuel Hahnemann, in the 18th century. He was from Germany. So, being a physician, he used to follow the conventional methods, but he wanted something simplified, easy to prescribe for the people who are suffering. So, he invented a method which is called as homeopathy. So, he started homeopathy in 18th century by a basic principle that he tried and tested a lot of things which work like on the principle of similia similibus curantur. So there he found out that the same medicines which see to be to simplify this is like cures like. So
Okay.
yeah. So if a substance is creating some symptoms in a normal healthy individual, so if those symptoms are present in the diseased individual, so that substance can be prescribed. So so that is the core of the homeopathy. So this is like cures like. If I want to give an example, then cutting an onion. So simply we cut an onion and then we get watery eyes, we get
Yeah.
running nose, we get some kind of throat pains a lot of people get. So these symptoms are always similar during hay fever, during influenza, some flu symptoms. So in those cases we can prescribe a medicine prepared from onions. So that is how homeopathy works.
Okay. So what you're saying is homeopathy was discovered by a doctor, a normal medical doctor, and he wanted something that was run by better principles, effectively.
Correct.
Okay, so and then you explained about the law of similes, that like cures like, and of course Hahnemann noticed that certain things that gave symptoms were also used as medicine. So he started practicing on that. So how does that differ from mainstream medicine?
So now the main difference lies in the preparation of medicine.
Okay.
See, the concept of homeopathy is different than the conventional methods because the law is different. We are prescribing the same medicine which can produce the same symptoms, right? So this is the fundamental rule of the homeopathy. The second difference is the preparation of the medicine. So here, what we do is we do not give the actual substance; we potentize it. So potentization is increasing the power, but it is reducing the material content. So in conventional medicine, the higher power means the higher quantity of the drug, right? But in homeopathy, we potentize. So we prepare medicines by potentization. There are two methods. One is trituration, one is succussion. So trituration is a method for insoluble solid substances, and the succussion is a method for soluble substances. So we prepare centesimal potencies. So there are decimal potencies and centesimal potencies and LM potencies in homeopathy. So here is a difference because more we dilute them, more the power of the medicine it becomes. It becomes more
Okay.
powerful.
So let me just summarize then what you've just said. So basically what you're saying is the more we dilute and succuss something, the higher potency it is,
Correct.
but actually it's got less of the original substance in it because it's
Correct.
more dilute.
To be very specific, after 12th centesimal potency, there won't be a molecule in the medicine. So,
Okay.
that is actually a concern of debate. A lot of people ask this because we do not have any molecular medicine giving. So, how the patient gets better? So here comes the theory of the water memory. Here comes the theory of nanoparticles. So there, that diluent, that water or alcohol, whichever the diluent we are using, so that carries the medical therapeutic properties with them, and then we proceed with making the newer potencies. So in decimal scales, we dilute it by 9 times. So the ratio is 1:9. For centesimal scales, the ratio is 1:100. So it is more diluted. And
Uh-huh.
and
Uh-huh.
for millisimal potencies, for LM potencies, we dilute from 1:50,000 dilution, 50,000. That is the ratio. So this is the extreme dilutions that we are making, but that is increasing the medical therapeutic property of that solvent or that dilution.
So what you're saying is most of the potencies that we give as homeopathic remedies don't actually have any of the original substance in there.
In
It
the higher
just has a memory of it
Yeah, it is in the higher potencies.
in the higher potencies. Okay. Okay. So does this explain then where the biggest misconception people have about homeopathy is actually it's just water?
See, that is actually a main concern, that people do not understand the memory created by the water, because water is known to retain all those medical properties inside it. We are using alcohol, a distilled alcohol or a water as a carrier, and that always retain the medical property inside them. So more we dilute them, the evoked medical properties are always there. So that is something which works on the inner layer of the immune system, and it triggers the vital force. So vital force is nothing but that immune system. So it triggers your immunity to heal the disease.
Okay, so let me just make sure that we're understanding everything here. So what we're saying is that this dilution, which doesn't have any of the original substance in there, just the memory of, actually works by helping our own immunity act better, be more strong, be more resilient.
Right. See, every disease and every healthy individual both has a immune therapeutic property with them.
Uh,
What we are doing is, we are not suppressing the things as we do in some other methods of medicine. So being a homeopath, what we do is we treat them from inside out. We want them to be better from inside. We want to treat that deficiencies, that disease, from inside out. We need to treat those elements from the basics. So we are prescribing on their whole personality. So homeopathy has a key prescription based on the individualization of the case. So what is individualization? It's a personality. So it's a complete personality that has to be taken in consideration before prescription of a medicine, right?
okay. Okay, so this is why then a homeopath asks so many questions.
Correct. That's correct. Because we need to dig into the physical symptoms of the disease. So if a patient is coming with suppose he's coming with asthma, so I need to dig into physical symptoms of asthma, that he has dyspnea, or he has breathlessness, he has some sputum or the mucus coming up. So everything has to be taken in consideration along with the mental aspects of the patient. So mental is what? The emotional trauma, the mental changes. So how does he feel? He feel ashamed, he feel irritated, he may feel discarded from the society, he may feel as if everyone suffers. Why should not I suffer? So that can be the other mindset. So everything has to be taken in consideration. So all that physical symptoms, the mental symptoms, the emotional trauma, if there is any, because many times we find out that someone loses a lot of his money and then he gets the suffering. Someone loses one particular person from his life and then he gets suffering. So everything, every trauma, every ailment has to be taken in consideration. Along with this, we are digging into the modalities, the aggravations and amelioration of the case. That asthma patient, if he's better in warmth, that we commonly see, so that is okay. But if there is one patient who's not better, who's better in cold winter, and he is asthmatic, then it's a specific thing. So here the medicine differs. So what occurs? They compare to compare this conventional medicine. They will be prescribing one particular criteria of the medicine to every individual who's suffering. Here, what we are doing, we are separating everything. So we want that if I am suffering, I require a different medicine. If you are suffering, you require a different medicine because our personalities differ.
Okay, okay. And what you said earlier was a brilliant example of a patient with asthma. One person might have asthma that came on after grief, and the other might have asthma after coming on as a child, and therefore it would be a completely different remedy, and we would choose the remedy dependent on all of the other things, the way
Correct.
that they react emotionally in order to find the right remedy that's right for them.
Correct. So what is this we are doing? We are finding out a simillimum. So this is a constitutional simillimum of the patient. So we are taking everything in consideration, and that will lead to a particular personality medicine of that patient, and that is called as the constitutional medicine of that particular patient. And then he gets healed, he gets recovered. So there will be then there will be less relapses, there will be less recurrence of the disease. And then that is how homeopathy is. See, here in India, a lot of conventional medicine doctors are referring their patients to homeopath, and the reason is
Okay.
this: because we are healing from inside out. So it works. It really works wonderful because we are targeting their own constitution, and this constitutional medicine triggers their immunity, and they start healing from inside out. So this
So
is
would you go as far to say that mainstream medicine will look at your symptoms or your diagnosis and give you a medicine for that, but homeopathy will look as you as a person and find the remedy, the medicine that is right for you, not for your symptoms or diagnosis or including your symptoms and diagnosis, but that's the difference with how it works. Is that right?
Yeah, it is very right. You simplified it. So homeopathy works in the same way. We are not focusing on the disease itself. We are focusing on the individual who's suffering with the disease.
Okay. Okay. And of course, how somebody reacts emotionally, how somebody reacts physically leads us to the remedy.
Correct. So we are connecting all those symptoms. So people usually ask to a homeopath, why you're taking 1 hour history, why you're taking 1.5 hours history, because everything is related. So we want to understand their trigger factors. We want to understand their inclinations. We want to understand their adaptations to particular situation, and then that rules out how this person reacts to the situation around, and then he gets suffered with some of the other triggers, and then we come to know that his constitution is like this. He is supposed to be suffered by this incidence, and then that particular medicine will be prescribed, and then he starts healing itself. So he gets better in some period of time.
Uh-huh. Uh-huh. Okay. Um, can you, I mean, a lot of people don't know about homeopathy or don't believe that homeopathy would work for them. But I often say to people, it's about looking at finding the remedy, taking back responsibility of your own health and actually deciding what the symptoms are actually saying, what really needs to be treated. So, how would you explain to somebody that is doubtful about homeopathy? What would you say for them?
uh, I usually give them one example that if the husband wife comes into my clinic and both suffers with the migraine, so I always tell them you are taking the same tablet given from the other pathy, and you sometimes you are better, sometimes you are not better, or at times your wife gets better and you don't get better. So
Yeah.
why if the drug is correct, you both of you has to be better, no? So here I insist, I emphasize the role of homeopathy that we need to dig into your personal things, your susceptibilities, and then this medicine will treat both of you individually, because there won't be a complete case taking for both of you, no? So they will require different case taking for each one of them. right? So I usually tell them that you need to be with me for some period of time. I need to understand your personality. Then I'll talk to your wife. I need to understand her personality. And for the same disease, both of you may require completely different set of medicines.
That's a brilliant way to describe it. Now, you mentioned before suppression of symptoms. Can you explain to me what you mean by that?
Okay, I'll simplify it because see, in lot of cases, what occurs, I am not blaming anyone, but the intentions are has to be clear. So if I'm going to a dermatologist will try to see. Suppose I have allergies. And I'm going to a dermatologist, so he will be giving me antihistaminics. He will be giving me some anti-allergics, right? So to treat my to suppress my symptoms, in short. Okay, if I have hives on the hands and on the body, he's giving me antihistaminics and I'm getting better. So that is temporarily suppressed at that point of time. I'm better, but probably on the next day or on next week, I'm having it again. So now they are giving me some kind of steroids so that I should not suffer. See, their point of view is clear. Their patient has to be better. So they doing good thing on their part, but the philosophy behind this particular conventional method is to treat the symptoms. So they want to eradicate symptom by any means. All right.
Okay. Okay. So what you're saying is people go to the doctor and say, I'm having an asthma attack, make it go away. I don't want to have this feeling again. And so the doctor is giving them something that makes that symptom go away. And the trouble is, it comes back. It keeps coming back. And so they keep having to take the medicine. Whereas homeopathy is completely different because it's actually saying, well, no, it's not the breathlessness that needs to be treated. It's something else. And we need to find out how to
Correct.
balance that other thing. And then the breathlessness goes away. So it's looking at the symptom in a completely different way.
Right. So if you're talking about asthma, what we commonly see is the physicians are prescribing inhalers, right? That the commonest prescription is inhaler. Nowadays, it is commonly prescribed to everyone. What we
Mm.
do in homeopathy, lot of childhood asthma cases, lot of adult asthma cases. So we are not they don't require inhaler anymore when they start homeopathy. So that is the kind of result they are getting. So they are happy when they are not taking inhalers, they are not taking steroid inhalers, they are not taking anything that is suppressing their current symptoms, because they are not suppressing to that in extent. So even if there are symptoms, so this will go step by step. They will be improving slowly and slowly, but the intensity and the frequency of the disease will be so lessened that they won't require any other medicine. That is the beauty of homeopathy.
Okay. And it's so interesting, isn't it, when you think that actually it's it's not healing or treating anything particular, it's just helping the body heal
Right.
itself.
It is just a small trigger to their vital force, the small trigger to their immunity to heal their own body. See, there is one more difference in compared to conventional medicines. They are prescribing on symptoms, but what we are doing, we have different set of understanding of practicing homeopathy. So we have therapeutic prescriptions. So if you are coming with asthma, so I know that this particular some of the medicines are better for asthma, so I can prescribe those medicines. Sometimes, if patient is coming with some particular disease, so suppose only right hand is involved, so we have one particular right-sided medicines for those complaints. We have psychodynamics with us. So psychodynamics is what our mind says that occurs on the surface. So we understand the mental pathologies, the mental understanding of the patient, and we relate them on the surface diseases. So likewise, we have different methods of understanding a personality that leads us to the complete symptom matching or the constitution. So if that once the constitution is found out, the patient gets better gets better very easily. So the prescription has to be important based on the case taking, and case taking requires all those factors to be taken in consideration. So this is how homeopathy works.
Okay, okay. So it's really interesting, isn't it? Because actually it's not that simple, really, is it?
Right, right.
When it was you explained that, he went through this to find a simple way, but But it is quite complex, isn't it? I mean, I know that we have quite a big book of rules, that organon, which is how we will find the right remedy, how we will prescribe the right remedy, how we will take the right remedy, how the remedy is made. I mean, all of those aspects are very, very clearly laid out in effectively the rule book of homeopathy.
Yeah, it's very true. Dr. Hahnemann has written that organon, and he has given all that rule book. Everything is there, that what need to be taken in consideration, what need not to be taken in consideration. How do we understand that patient is getting better or not better? If this is a suppression, we can understand that with the symptoms, that are coming into follow-ups of the patients. So everything is there. We need to dig into it. We need to understand. We need to learn homeopathy thoroughly, and then it becomes easy. See, I'm talking this after so many years of the practice, and here we are not the alternative methods. We are the mainstream medicines. So the exposure is quite different in India compared to the Western countries. But homeopathy, anyways, it works wonderful throughout the world, right? So everything has to be taken in consideration. It is never simple, but it is easy to understand.
And how do you explain to people who just think that homeopathy is placebo?
Uh, uh, See, there I usually tell them, if this is not a medicine, if whatever I'm prescribing is not a medicine, then they should not be better. So even if I do not go for a 1 hour case taking and I prescribe them something, they should not be better. But at times, whenever we see a particular person who's deceased, so we can understand their physical makeup, their talking sense, means their behavior, so everything will be understood, and we can prescribe a medicine based on that, and that actually works. So if it is a placebo thing, it won't have worked. So
Okay.
I usually ask them to wait for a couple of minutes in my clinic only, and
Uh-huh.
then I again see them after 10 minutes, and I ask them that how is the change, right? So now see, placebo effect is what these people are considering that it is just a salvation that we are giving to the patient, but it is not like that. It's a medical property that works. It
Yeah.
is not only the sympathy or the faith that we are giving to the patient, that everyone does. Even conventional doctors, they talk wonderfully to their patients, but all of them doesn't get better. The same thing occurs in homeopathy. If it is not a medicine, it won't work, because
Okay.
good talks are done by everyone.
Things don't happen. Okay. And just so that we're understanding, do the general public have to change their conception of health in order to allow homeopathy to work or want to explore homeopathy or change how they perceive their symptoms in order to explain more details about what possibly could be causing that imbalance?
So you want to ask about the people need to change their perception about homeopathy.
No, their perception about what their own health is,
Okay.
about what being better is, about what a cure is, about going to the doctor and asking for a tablet that makes the symptoms go away. And then the opposite to that, obviously, the homeopathic area is saying, okay, how can I get my body to be better health, to be more balanced? What do you need to know?
Okay. See, homeopathy is a method which is very simple and harmless, because taking sweet pills is never a pain, right? So I usually insist people to understand that if this disease is recurring again and again, if this is even after taking medicines, there are other symptoms that those are coming up and they are making you weak, they are making you ill at other times. So it is better to switch to homeopathy, because it will be harmless. It will treat you from the roots. It will treat the after effects of the medicine also. So in total, homeopathy will take care of you during the disorder and after the disorder. So it will make you healthy. Basically, what we are doing is we are maintaining the equilibrium of the case. So equilibrium is what? To keep the patient healthy in every state of mind. So that is what we are doing. So a lot of people are coming from a lot of devastating diseases like cancers, like asthmas, like skin disorders. So those people, we are insisting them to follow homeopathy for long period of time so that they should be healthy and they will be psychologically better that they are under effects of medicines also. So likewise, I
And
explained that.
And people are often amazed, aren't they, at the different things that happen with homeopathy. Because, of course, with Western medicine, they might say, oh, yes, that remedy stops that, but it gives me this side effect.
Right.
Whereas with homeopathy, we have the opposite, don't we? So we start to take one remedy that we think will help this. And then all of a sudden, we realize we've got more energy or we're sleeping better or something else has changed that we weren't expecting
That is what is expected from the medicine, no? Because we are treating them from inside out. We are making them healthy in every sense. So they
in
have to
every
be
way.
happy, healthy after taking the medicines.
Okay. Okay. So if you go to a homeopath with one symptom, it is not just one thing that will go away. It is a whole series of things that will change and make you as good as you can be.
I'll tell you one thing. Even if there are a lot of people coming up to me, they are coming with one particular. Suppose asthma case comes, and he has some other issues in the past, or some other complaints also. He has some skin issues and everything, and he doesn't tell me that. He just comes for the asthma. Okay, doctor, I have this breathing issue, and treat me for this. After giving prescription, in the second follow-up, they come and tell, doctor, I didn't tell you about my skin disease and it is better. So how come you know that this will also get better with the medicine? So this is the holistic concept of homeopathy, where that constitutional medicine treats everything that person is suffering with.
Nitin, that explains how homeopathy works beautifully, doesn't it? Because what you're actually saying is we choose a remedy on the things that you tell us, but it also treats the things that you don't tell us.
Correct.
And
Right.
and really then that answers the whole question of placebo, doesn't it?
Correct. So this is
You
so
know,
fascinating, no?
yeah, isn't it? You just start to get absolute wonders, don't you? About my goodness, what if everybody knew about this?
Correct. So being a homeopathy professional, we are expecting that smile from the patient that he's better.
Yeah,
That is the
yeah,
least
yeah.
accepted thing from the
And
client.
that he feels happy
Yeah,
because so many people forget what being happy is, don't they?
that is what we are working for.
Yeah,
Yeah.
yeah. Oh, well, that's a brilliant sum up for how homeopathy works. So thank you so much for coming in and explaining that for us. Thank you.
Thank you. Thank you, Mary, for inviting me again. Again, I'll be happy to be here. Thank you.
Well, I hope you enjoyed today's episode. It really was fun actually to address that fundamental question, how does homeopathy really work? And if you enjoyed this episode, then please do check these out because they are going to be absolutely fascinating for you.